Today is what? November 22,
22.
and we're having our in-service on infection control, specifically on viruses and bacteria. We're going to talk a little bit about.
Can I have a paper?
Yeah, this is the text. Make sure you sign in. We're going to talk specifically on the difference between mRNA vaccine and the traditional vaccine, and in terms of like infection, inflammatory response, how to basically visualize the patient and see whether they have an infection based on the type of assessment that we are looking at. Okay, so as far as infection, we're dealing mostly in this category as far as nursing goes, viral and bacteria, but we also deal with fungal infection. As you know, we had a rise of superbug in terms of fungus in the last couple of months, and specifically Candida albicans, I believe, and there's no treatment for it. The usual antifungal that we usually use to treat our patient has been significant, and it has not been effective to treat these fungus, and so it's very difficult. That's why we had a patient here, I believe it was room 14. He was exposed to this fungus. Remember, state came in and they tested him, and we had
14?
Yeah, I believe it was 14. It was a couple months ago. But we didn't get the results till like over a month and a half late afterwards. So he was in quarantine or isolation during that time because it's such a significant infection in terms of fungal and treatment, and not having the treatment, that if he did get it, that he was positive, and then he passed it around the community, it would be really hard to get it. And then people get sepsis from it. Okay. Anyways, let's talk a little bit about immune response, because there's two ways that your body responds to an infection. There's an innate type of response, and then there's also the acquired type of response. And this kind of goes back to like vaccination, how vaccination works, because a lot of us, people ask us as nurses, how does vaccination work? And we know the very basic, but I kind of want to give you an in-depth look of how these vaccinations actually work. When you get an infection, if you've never seen this virus before or bacteria before, your body responds with an inflammatory response, right? You get this white blood cells that kills everything and eats up everything. The only problem is that it's got inflammatory response, and so you have a lot of symptoms. Okay, so if it's your first infection and you're not vaccinated for it, if it's a virus, whether it's a bacteria or a virus, you're gonna have symptoms because of the fact that you have inflammation that's coming in. Okay, the difference between that and somebody who's vaccinated is that a lot of times it's specific to the cell, right? If your body has seen it before, it'll go after the virus and kill it, specifically the bad viruses, and then you won't have as much symptoms. Okay, and I'll go over that a little bit as far as vaccination go, how vaccination works. But just remember that when you get an infection, you've never seen it before, you don't have immunity for it, you're gonna have a lot more symptoms and then you're gonna be sicker longer because your body takes about 7 weeks to build up an immunity to kill that virus or bacteria. Okay, so that's the difference. And let's talk a little bit about inflammatory response. When your body responds with inflammation, there's 4 signs that we look for, and this could work for CNAs too, right? If you're working with a patient, it could work for a local infection like a skin infection. It could work for a respiratory infection. Okay, so the 4 signs of inflammation is pain, redness, swelling, and then heat. Okay, so for example, if you have a patient that has open wound and you have increased swelling, you have some redness, there's heat on there, right? There's pain on there. Those are all signs that the patient is probably going through some form of infection. And you're gonna go up to your nurse and say, hey, you know what? I got all these 4 signs here. This is likely an infection for this site. Okay, so why do we have pain? Usually your body tells you that, hey, you know what? You're having a bad infection here. It's gonna trigger your pain receptor. You guys gonna tell your brain, hey, something's going on with this tissue. You're gonna have some pain there, so that way you're aware of it, right? Now, redness. Why do you think you have redness on there?
Because it's inflamed from the infection.
What is it? Yeah, it's irritating. The thing is, your blood is bright red. And so it's turning more red because you're pushing more blood in there. Your body responds by saying, let's push more blood in there. Okay? And that's the same thing
Trying to
with
heal
swelling,
itself is
right?
what essentially it's trying, right?
Absolutely.
Yeah.
And so swelling, the same thing. You bring in more white blood cells to kill off the bacteria, and then you bring in more red blood cells to bring in more nutrients. And so you get that swelling. Same thing with heat. Why do you have heat in there? Where's that heat coming from?
Your body.
Your blood. What do you think your blood is? Cold or hot? It's hot. It's
Hot.
warm. So you have increased circulations. You have those heat that's coming in there. Okay. So those are the 4 signs of infection. If you know those, and you're looking at a tissue that's inflamed, and you're just like, hey, I'm gonna go over to my nurse and tell her. Your nurse should know this. They know the signs of inflammation, and they're gonna be like, oh damn, let me call the doctor because you might need some antibiotics, right? So, and that's the main reason why we're going back into the first site of infection. If you've never gotten infected before and now you're getting infected with COVID, you have all these symptoms is because you have inflammation that's kicking in. Okay. All right. Now let's go down to antibiotics, antiviral. Okay. If you have a bacterial infection and you're coughing or whatever, or maybe let's just say you have a viral infection, right? And you're coughing, you got bronchitis or whatnot, and you're just like, hey, you know what? Let's go get antibiotics because I want to treat this. Okay. So usually 99% of the time, your respiratory infection is going to be virus. Okay, so people trying to kill the virus with antibiotics, what do you think you're doing? It doesn't work. It doesn't work. And I know even nurses sometimes will get this confused because like, hey, you know what, I got coughing, congestions, let's go to the doctor, let's get some of these, antibiotics. It doesn't work because it's a virus. What you need probably is a steroids, because what does steroids do? They decrease inflammatory response. Okay, so instead of getting antibiotics or whatnot, try to ask for some steroids. Okay, what do we typically do for people that has a cold and has symptoms of coughing, sneezing, congestion?
Drink a lot of water.
Drink a lot of water is the best thing you can do, right? If it's
Take
not.
your temperature, you got to make sure they're
Dehydration?
make sure they're being controlled.
So
their temperature
here's the thing:
being
if you have a
controlled.
cold, who thinks cold and flu is the same? Cold and flu. If somebody says I have a cold, and then somebody's,
Yeah, what's
can
the
be.
what's the difference? What is the difference,
Yeah,
guys?
what's the difference?
Okay, well, we had this topic.
fever.
Okay, so here's the thing: the flu is influenza. Okay, you get A and B and C. A and B is is the one that can cause pandemic, epidemic, all these widespread infection throughout the world. That's the flu, and you have more significant symptoms, right? You have these body aches, you have fever, you have chills. The cold is your common cold. You might have coughing, sneezing, and respiratory type of thing, but you likely will not have a fever. You likely will not have a body aches. Okay, but you start having fever, chills, and body aches. It's probably because you have the flu. Okay, the cold. If you're cold and because you're coughing, you feel like crap and you're dehydrated. What you need to do with cold is just rest up. The same thing with the flu a lot of time, right? If you have antiviral, you can take antiviral for the flu, but with the cold, you drink a lot of water, you rest up. That's the modes of treatment for cold. Okay, now flu is something different because it's more significant. Okay, and it can kill you. It can kill your residents. And so if you get a flu, you want to isolate that resident. You want to take some antiviral, and you want to take care of that resident. Okay, so that's the big difference in terms of antibiotics goes, and then cold and flu. Now, antibiotics doesn't really work for viruses or antivirus doesn't work for bacteria because bacteria has a cell wall. And so here's and a lot of people thinks, well, why doesn't the antiviral works for bacteria? Like I said, let me draw this real quick. Okay, so you have a bacteria that has an extra layer. If you have a virus that wants to come in and kill this bacteria, it can't because it has a cell wall here. Okay, now the antibacteria type of medication, it will puncture a hole right through the bacteria. It'll kill that bacteria. Okay, and so what a lot of times happens too is that bacteria doesn't have to work inside the cell. It can just attach into the cell here, puncture, and then kill the bacteria. Antiviral can't do that. It has to go into the cell. If you have a virus, okay, the virus for viruses is different from bacteria because they go into the cell. Okay, where bacteria, it doesn't affect the inside. Okay, it will infect the cell, but in order for us to kill the virus, you have to go into the cell. And so when you have antiviral,
The nucleus of the cell, the inside.
right, he has to go inside.
Yeah.
He has to go inside. Antivirus has to go inside to
Yeah.
kill the cell.
Right.
Just remember that. That's why it doesn't work with bacteria, because bacteria has a cell wall. You can never puncture that bacteria. Okay. Now, if you have a virus, it's only got one layer. The antiviral will go straight in, kill the viruses inside, and then kill the host and kill the cell as well. Okay. So that's kind of like just a crash course on why antivirus is different from antibacterial. Know your infection in terms of nurses goes, because you can't treat things like bacteria and viruses and get it all mixed up. Now, vaccine. Let's talk a little bit about vaccine, because a lot of people will sometimes confuse this vaccine. The traditional vaccine involves a weakened virus. Also, it has, what is this thing that I drew? Does anybody know? Oh, here's what I drew. Okay, just imagine that this is a virus, right? And the traditional vaccine will either have a weakened whole virus like this, or they will take an antigen. This is an antigen, a protein spike that comes out of the virus, right? They will take some of that and they'll put it into the vaccine. Okay, now if you're injected with this, your body is gonna come out with your blood cells and say, hey, damn, this is an antigen right here. I'm gonna kill this off. But then it has a memory, right? So it might take a week for it. So it has a memory. So the next time you get sick, you won't have symptoms. Okay, whereas if it's the first time you're getting sick, it's a real virus, it's gonna take you a whole week to build up immunity to kill off these viruses. That's why you get sick for a whole week. Okay, now if you take the traditional vaccine, it does the same thing. It introduces a weakened virus where it can't infect you, and then it builds up immunity. So when you get sick later on with the same virus, you're not gonna have as much symptoms. Okay, now the RNA, the mRNA, what they do is that they will inject, it's a protein basically. It's a messenger protein that goes into the cell, and it's telling you there's no viruses involved in mRNA. Okay, none, zero. Okay, some people think, oh, there's a virus in there, I'm not going to take it. That's a traditional vaccine. The mRNA involves zero viruses. It has a protein base that tells your cell, hey, start making these antigen. Your cell will, you get into a specific cell, it'll tell your cell, start making these antigen that's specific to this COVID-19. Okay, so it starts, so now the cell starts making this antigen, not the actual virus. You're not gonna get sick from it, it's just an antigen, right? And then your body will respond with white blood cells. Damn, there's an antigen, I'll kill that. And then it'll start building immunity. So next time you get this kind of virus, now it has the memory to like, okay, that's the virus I wanna kill. Okay, but just remember that mRNA is probably one of the safest vaccines you can take in terms of, am I going to get sick because of it? Now, your immunity might respond in a certain way, inflammation, and you might have some form of symptoms like coughing or whatnot and body aches because your body's responding to that. Okay, it's the inflammation part that's making you sick. Okay, so anyway, if somebody asks you about vaccine, how it works, and whether it's effective or not, of course it's effective. Why is it not? Why do people sometimes though still get sick? It's because this virus right here, this damn virus right here, will change all of these antigen. It'll come in. Not all of the antigens are going to change. Some of them are going to change. Okay, and it's going to be really hard for us to say, okay, let's inject this protein in here and tell the cell to make this antigen. If you make the wrong protein, you know you're going to get sick, right? But at least it knows now. You know, even when you get sick, you're not going to have the significant symptom compared to if you didn't get vaccinated. Okay, because now you have some form of immunity. You have white blood cells to say, let's kill off these viruses, okay, before we get sick. Okay, so it's kind of like our way to just really remind people, you know, that the vaccines, although it's not 100%, that, you know, it's still a really good, it's still a really good type of treatment. It's not really treatment, it's prophylactic. You know what I mean? So that way you don't get sick. Okay. Anyways, I wanted to bring that up today, and because of the fact that we're going to be going into this flu season, and if you haven't gotten your vaccine, you really want to think about trying to get your vaccine to try to decrease your chance of going to the hospital if you do get sick. Okay. So, and the last one, it says, what are antibodies? Basically, antibodies, if you start building up white blood cells, you start building up antibodies. And antibodies, what they do, when you have a virus that comes in, they can clump into the antigen of these viruses. And so if this virus is trying to infect another cell, they can't, because their antigen is filled up with these antibodies. Okay. Not only that, the antibodies will trigger another cell that says, "Hey, the antibody will start sending messages to like a macrophage, which is a white blood cell, that says, eat me, or whatever," because they're stuck with these viruses. I caught a virus, come and go and eat it, right? Same thing with the virus. A lot of times, your cells are very smart. If they get infected, they'll start producing the antigen for the virus, and it's like a suicide type of thing. And so when your white blood cells recognize it, it'll eat the whole cell. It'll kill that cell. So that way, if it's a virus, here's the thing with the virus: if the virus gets into the cell, it'll start producing viruses. When it finally explodes, now you have millions of viruses. So before it does that, your cell will start producing antigen. So that way, your body will say, "Hey, you know what? Come and get me. I'm infected." And so the white blood cell will come in and eat it. But that's a way for us to really increase our antibodies. And the way to do that is to get your vaccination done. Okay. But getting infected obviously is just as good as vaccination, because you already have the antibodies for it. Okay. But it's just that vaccination is just another step, another extra push to increase your, antibodies. Okay. So let's go over some of these questions. Any questions on infection and viruses? Why bacteria is different than viruses?
Probably got a billion of them.
You got a very okay.
Because it's something that we really haven't heard that detailed before.
Yeah.
About the antibodies and stuff.
Absolutely. And so I hope that kind of helped out a little bit. But if you do have questions, let me know a little later. Okay.
Yeah.
All right. Let's go over question 1. I can take antibiotics for my viral infection. Is that true or false? That's false. Okay. 2. I will not have symptoms if my body responds to an infection with a strong inflammatory response. So if your body is responding with an inflammatory response, you're gonna have a lot of symptoms. Okay, because inflammatory response means you're gonna have coughing, you're gonna have wheezing, you're gonna have all these phlegm and stuff like that. That's just the way your body is saying, "Yeah, I need to get rid of these viruses, however way I can, by
So the phlegm
coughing
is
out."
actually carrying it, and then your body tries to get rid of it.
Yep, absolutely.
Got it.
Okay, inflammation is an indication that the body is fighting off pathogen. List 2 out of 4 inflammatory response. I gave you 4 here, but what's up? Pain is one of them, right? Redness, swelling, and then heat. Okay, good. So, and this is not just for nurses, and this is why I bring this up in our little lecture here, because I want us to be as comfortable as the nurses when they're looking at infection, because you're looking at this a lot more than the nurses. You're gonna be like, "Damn, that skin looks really warm. It feels warm. It looks red. There's some swelling in there, and then she's having pain." That's an infection, right? Mm-hmm. Right. So this is an easy way to kind of take a look at that. All right. What is the primary methods of treatment for the common cold? Obviously, you want to rest, drink a lot of fluids, and this is what I was gonna. Yeah, rest and fluids. Okay, getting vaccinated will prevent me from being sick. That's probably false. You're still going to get sick. It's not 100%. And then true or false, the new mRNA vaccine contains live viruses or parts of a virus. That's false. Absolutely. All right. So somebody asked you a question. You know now. Let them know. Okay, guys. Thank you.